be able to get meals, they want to be getting their activities, and the challenge, and I hope you don't think it's too silly a metaphor, but I found people have understood it, is why can't we have residential facilities that are like cruise ships, right? Think about cruise ships, right? Rich people pay enormous sums of money to essentially be locked up, right? I mean, you're on this boat, right? You can't get off, right? There's nothing needed, right? Why do people agree to do this, right? What kind of crazy person would pay huge sums of money to be completely isolated? Well, it's advertising, but they have phenomenal food. Ask anybody who goes on a cruise. They have phenomenal food, and all day long, they have fun activities. And so, you know, the question on a metaphor that I've been posing, you know, to Robin and Mary, and that I would like to engage all of you with, is what would it mean if instead of some portion of IMD beds, we had residential programs with phenomenal food, where people felt that, gee, if only I stay till tomorrow is the day that they have pulled pork tacos. On Wednesday for lunch, there's always pulled pork tacos, and if I'm going to leave this place, I'm not leaving, you know, on a Tuesday, right? Maybe after I have the pulled pork tacos, I'll leave. But by then, maybe we can entice them, you know, that there is an even better meal coming, you know, on Thursday. What if, you know, these places were filled with activities that people really enjoy, right? Now, I'm not saying that this would work for everyone, but in order for us to make progress, it doesn't need to work for everyone, right? If we could imagine that 30%, and again, you know, this is always how I like to think, you know, big system before we try to make it work. If 30% of the people who are currently in IMD beds could succeed in, and again, I don't want to confuse intensity of service with logs, right? So the same level, or for that matter, could be a more intense clinical level of service, right? If 30% of the people who are either in IMD beds or need IMD beds could make it in a residential with an incredibly intense set of services, and the positive enticements that would keep somebody wanting to be there, think of the potential, because we can't get any revenue for those beds, right? We could get 50% for a revenue back for everyone who we put into one of those beds who had Medicaid, if we did the residential unlock. Well, that's a lot of money. Yes. That's a lot of service. And I think that as a, you know, long-term goal, and it is, right, first we have to agree, do we agree on the vision? Because of course, you know, then we have to find the facilities, we have to site the facilities, we have to open the facilities, we have to identify the clients. So it isn't a snap of the fingers. But if we accept the idea, if we say, gee, that is the right idea, then given the creativity of all of you and the people who are in the Department of Mental Health, I have no doubt that that's something that we can achieve. The last sort of big picture one that I'd like to have us think about is the healthcare needs of people with serious mental illness. We know that people with serious mental illness die substantially earlier than people without serious mental illness. That's in Los Angeles, that's throughout our country. And we also know that they're not dying of their mental illness. They're not dying of suicide in general. They are dying of generally heart disease or liver disease, things that are related to substance use, sedentary lifestyle, side effects of the medications, smoking, you know, really major decreases in lifespan. Now, I think that as a big picture issue for us to take on, trying to change that would be incredibly worthwhile, and I think that's an entirely doable thing. It doesn't mean in any way that all of those people need to get services at the Department of Health Services, but it may mean that, and this is something we've been working on with Dr. Shaner, it may mean that we want to make sure that for everyone who touches the Department of Mental Health, that we're certain that they have a doctor or a nurse practitioner somewhere, that they've had cancer screening appropriate to their age from someplace, that someone has checked to see if they have had diabetes, someone has addressed their smoking, right? There's a myth that people with mental illness can't stop smoking. That's not true. Lots of people have trouble stopping smoking. People without mental illness have trouble stopping smoking. People with mental illness have trouble stopping smoking. It's a very addictive behavior. But by all means, we should be engaging people on stopping smoking, right? It can be done with both groups. There are evidence-based practices. What we don't want is people saying, oh, well, this person has mental illness, it'd be too difficult for them to stop smoking, right? That's not fair. That is, resigning somebody to a shorter life and greater morbidity without engaging them on the question, maybe they could be one of the people who could stop smoking. Maybe they could be somebody who could stop using meth. Maybe they could be somebody who could, for both their mental health and for their physical health, could start doing yoga or Tai Chi or be in a walking group, right? What have we done within our world to try to make sure that people have taken fullest advantage of all of these things? So, those are the big picture things. I want to close by introducing Sandy Banks. I don't know how many of you know Sandy. Sandy has had a very distinguished career as a columnist for the LA Times. She has written a lot about many of the issues that we've all worked on, issues of homelessness, issues of substance use, issues of mental illness for the LA Times. And I've asked her to come on and work with me as a community liaison to really help me in engaging the community and community stakeholders, because there are a lot of people who are committed to the well-being in Los Angeles, a lot of different meetings that I want us to have a presence on, and Sandy has agreed to come and help me engage people. Okay, so that's what I'd like to start.
Wanted a conversation, so what we're going to do is open up comments or questions to Dr. Katz, to the SLT members, and I'll go around the room. And Mrs. Lamont, I will start on this side today, your side, and then once we have gone around the room here, we will ask questions of the audience. Okay? Are you ready?
I'm ready, Mrs. Lamont.
Okay, Mrs. Lamont.
She and I are old friends. Nice to see you again.
Yes, good to see you. My question is, I'm trying to follow all of this stuff, is what you're saying about having this residential place, will that include not taking people to jail and taking them?
That could be one of the purposes we would use it for, is an alternative, Mrs. Lamont, to jail. So I think that would be a great way to use the park.
Right now, I think that's the main thing I was concerned, because I'm concerned about not even taking people with mental illness to jail unless it's a horrible whatever they do.
You are so right, and in part there's tremendous cost and harm.
Right.
In even just the initial, jailing procedures, the court procedures. If we can have alternatives, that would be phenomenal.
Thank you for being here, Dr. Katz. Maybe it's more of a reflection on your part or your thoughts about just making sure that as you talk about the integration of the services, the role that we have in our communities in terms of our schools. A lot of our youth there are falling through the cracks for a number of reasons, including conversations about our school-to-prison pipeline, our marginalized communities, youth that are being pushed out of our school system, and their needs are not being met. I know that LA Unified is involved. There are some charter programs as well, including myself, that are involved in providing mental health services. But just your thoughts and ideas of how to incorporate, especially in our inner cities, incorporate more services for them that as you manage through the various systems that we're incorporating that particular population.
Well, thanks for the question. Thanks for the work that you've been doing. I like the wellness centers in schools. I've thought that they have been a success. I favor trying to broaden them so that family members can come too, because I think it's a way of making that service more sticky to the family. You know, I'm very concerned that many of the kids that are most in need are part of our foster care system, and we have not done it right by them. They're often kids who, you know, you would really hope that the community recognizing that their parents weren't able to provide good parenting, that we would then rise to the occasion of making sure that they had the best possible experience to make up for things. I don't think that's what usually happens. You know, a lot of the effort, and I know Robin is doing a tremendous amount with her staff around foster kids, trying to do it, and that schools need to be both the center and they need to be a positive outcome. And one of the things I've learned from you and your colleagues is that when it comes to kids, we shouldn't just be talking about things like not being hospitalized, right? We want to talk about things like full potential, right? Kids going to college, kids having happy lives, right? What do we need to do to make up for it? So I'd be happy to work with you on that.
Karen?
Dr. Katz, I'm so surprised at how much you've changed since the last time.
Taller? Who wants to be taller?
The last time I said I didn't think we'd agree, and I'm finding a point of agreement that is absolutely amazing, but that's because I worked for 2 hours on the drive-in to make sure I would be receptive. Your example of the cruise ship, if we look at substance abuse and the high-end rehab facilities, the high-end sober livings, their whole focus has been on how much money can be made because they keep their residents occupied with good food. But also, if you look at current science, particularly Dr. Candace Pert, and the agriculture industry about the recipients in the brain and the molecules in our intestinal tract, there is such a correlation in writings over the last 100 years. I think that if we look a little bit outside the box, we may find an incredible idea and work out there in the general community.
That's great, thank you so much.
I'm going around the room. There is